Adoatv, bringing good things to life.
Friday, the 15th day of May 2020. It's good to come to your homes with another edition of AM News right here on Adoatv Television. My name is Nani Macaulay, and let's take our news highlights. Novel coronavirus could become endemic. This is coming from the WHO. Now, Ghana case count now at 5,530. We don't believe lockdowns would work anymore. Minister for Health. We have these and many more coming up shortly. Please do stay with us. Streaming live on Facebook, you may want to join us with your thoughts and comments. And let's take the details now. The World Health Organization has made it known that the novel coronavirus disease could become endemic and may never go. According to the WHO, the virus would live with humans like HIV, and populations around the world would have to learn to live with the virus.
The novel coronavirus, known as COVID-19, appears to have originated from Hubei province in China, where many lives were claimed. The virus in December last year came as an epidemic, mainly limited to China, but as time goes on, the outbreak spread widely and swiftly to every part of the world, bringing the world to a standstill. Millions of people were infected by the virus, with thousands dying out of the pandemic. The situation, therefore, forced all leaders of the globe to restrict movement to help control the virus, while measures were also put in place to curb the spread. But the rate at which the virus spread so swiftly and widely was beyond imagination, which in many countries became out of hand. So far, 300,000 deaths have been recorded globally, with 4,223,047 confirmed cases reported. The World Health Organization has also made it known that the new coronavirus disease may never go away, could become endemic like HIV virus, and populations around the world will have to learn to live with the virus.
Let's come to Ghana now. Ghana's confirmed cases of the novel coronavirus is up to 5,530, with 674 recovering from the disease and 24 deaths recorded so far. In a press briefing, Dr. Bedusa Kodye, the health of public health, mentioned the areas of the hotspot.
From the last briefing, the new cases confirmed that added to what we reported 122, with the distributions in Greater Accra 57, Ashanti Region 62, Central Region 2, and Western North 1. 2 more new deaths were added up, bringing the death toll to 24. With 24 deaths among 5,530 cases, the death to positivity rate, which we term as the case fatality rate, stands at 0.43% for the country. The total number of recoveries have increased, and indeed we have done quite a significant number of people having done the first test, which is negative, and you are waiting for the second test to declare them recovered, fully recovered. And the total number of recoveries as of now stands at 674. I'll just give a bit of details with regards to the new cases that we confirmed. In Greater Accra, 57 cases reported came from Temamet 51, Ashama 2, Polikrote 1, and 1 each from Accra Metro, Ladadi Kotopon, and yes, I think these are the districts from Accra. Central Region reported 2 new cases, 1 each from Ewutisenya, East Kaswa, and then Winneba, 1 each. Ashanti Region reported 62 new cases, 12 from Kumasi Metro, Obuasi Municipality 22, Askorimampon 1, Afijasachre South 2, Achuma Kwangoma 19, Pai 1, Tapo 1, and then Salvation Army Hospital also reported 1. We had 1 new case from Bibiani, which is from Western North. This brings to the total new confirmed cases to 122. With regards to the regional distribution, Greater Accra has 4,204. Ashanti Region, 788. Eastern Region, 99. Central, 192. Western, 61. Western North, 57. Volta, 34. Otirin, 24. Northern Region, 19. Northeast, 2. Upper East, 26. Upper West, 21. Bono East, 1. So out of the 16 regions, 13 of them have reported cases, and those regions that have not reported cases yet are Bono, Savannah, and Ahafo. I think, Your Honor, the Minister of Information, this is
The Minister for Health, Honorable Kweku Agyemang-Manu, has disclosed that government believes that both partial and total lockdown doesn't work any longer. The Minister for Health indicated that the initial lockdowns taught the country a lot of things and the impact has been severe. Hence, Ghanaians must learn to live with the disease.
Answering a question on Thursday, 14th May 2020, at a media press briefing about whether or not government was considering locking down Obuasi, a hotspot of the disease in the Ashanti region, the health minister said lockdown isn't the way forward.
Generally, the lockdown is not something that we believe is going to work any longer. I've said that now we have realized the lockdown taught us a lot of things, and its impact is quite severe. So what we have to do now is to learn to live with the disease. So they go and come back and we'll get their report.
Mr. Agyemang-Manu said he has asked the Director General for Ghana Health Service to visit Obuasi with a group for surveillance on the people, and until he comes back, it will be difficult to answer any questions.
The General for Ghana Health Service should be in Obuasi with a group of epidemiologists and surveillance people now. Not until he comes back. This question will be difficult to answer. Go and come back and we'll get their report. It will determine, it will drive us to make certain decisions, and not until they come back. We must be very careful as to whether we are talking about lockdown in Obuasi or not.
Meanwhile, Honorable Agyemang-Manu indicated that our death rate is still low, yet we must not give room for the virus to expand.
Our death rate is quite low. That does not mean that we should allow ourselves to be infected with the disease. So what we have to do now is to live with it and manage ourselves against it. So what should we do? So far, there is no medication we can take. There is no vaccine that we can actually get to vaccinate ourselves against the virus. But there are certain things that we know we can do to protect ourselves.
He, however, beckoned on all and sundry to ensure they adhere to the preventive measures that have been laid out worldwide.
So what we have to do now is to live with it and manage ourselves against it. So what should we do? So far, there is no medication we can take. There is no vaccine that we can actually get to vaccinate ourselves against the virus. But there are certain things that we know we can do to protect ourselves. One of them is what I'm wearing. So we are managing to reduce the spread. Because when people, all of us, when we see numbers of infections going up, we begin to get scared. So why would we want the numbers to continue to go up? We will have to find a way to ensure that the numbers don't go up, but they begin to come down and come down and come down. So if we are adhering strictly to the guidelines, the education, the type of things we are seeing here on the screen, strictly by them, we will be seeing these hypes that is going on in some parts of the country. One, we have managed to establish that when we continue to do our things in groups, we increase positivity. Those in the factories, those in work camps, mines, the railway workers at Eastern region. So what do? They are asking us to observe social distancing. Yet, some of us behave as if we haven't heard what is going on. So we should begin to accept the fact that the disease will be here for a while, but we should try to reduce the rate at which we are spreading and getting infected.
Honorable Kwekwajiman Menu, in a press briefing, said as part of measures to prevent the spread of the deadly novel coronavirus, it will be appropriate to avoid talking, singing, and laughing when you are not in face masks. By doing so, the virus is exposed to innocent souls. Mr. Ajimamenu, who is deeply worried about the increase of confirmed cases in the country, said it is very important to ensure that we are in face mask always.
Which door do they use to enter the canteen? So many of us are talking unnecessarily. And if you are infected, you open your mouth and the virus comes out. So again, if you don't need to, don't talk. Especially when you don't have the mask. They are telling us that we shouldn't even laugh, especially when you don't have the mask. You shouldn't even sing. You see where we are moving towards. If you don't observe these basic guidelines, the disease will continue to spread. Unfortunately for us, in one aspect, and I'll use the word reservedly, unfortunately, a large number of those who have been tested positive don't show any symptoms of illness. The scientists use a word they call symptomatic, meaning that you are positive, but you are not showing signs of illness. And that makes our situation very dangerous. If somebody is showing signs of illness, he or she himself or herself will go to the clinic, and when they test positive, they will begin to treat a sick person. But those who are not ill, if the enhanced contact tracing people don't pick you as a contact of another person so that they are coming to try to test you, nobody comes to you, and you are in the community, and therefore the relativity of spread begins to become bigger. And that is why we say if you're observing the rules, whether asymptomatic or symptomatic, we are cutting you off the red chain, and we can then protect ourselves and you yourself as well. So let us continue to observe these regulations. At the workplace, we shouldn't be so of us. By tomorrow, we might have come out with guidelines to guide employers and employees so that workplace practices will begin to also help cut the spread and bring the positivity down.
We'll still stay with the Health Minister, Honorable Kweku Agyeman-Manu, and he has stated emphatically that those who wear or refuse to wear the face masks in public will be arrested and jailed for at least 3 months for flouting the preventive measures to avoid the spread of the virus. To avoid COVID-19, the World Health Organization, Ghana Health Service, and the President has put in place preventive measures such as wearing of face masks, washing of hands, using hand sanitizers, among others. But these measures seem not to be at work, as some persons have refused to adhere to these preventive measures, paving a way for the spread of the virus.
If we should begin to get ill, our hospitals will be full. And then we may move into situations where people are showing symptoms, they are dying, and wouldn't have places to take them. And that is not what all of us wants. So if we don't, at this stage, find a way of cutting the spread, and we allow ourselves to be moving toward that era, our situation will be catastrophic. So all of us should become ambassadors to preach wherever we are that we should observe the basic rules or guidelines that have come out. They are not very difficult to do. So I don't understand why some of us will not do these things. And we have been thinking about what next do we do to enforce strict compliance with these basic guidelines. We are working on that. I believe soon we will see the police arresting some of us who are becoming too recalcitrant. And if you are jailed for 3 months for not wearing the mask in public, probably we'll take a cue from that. So I came to talk to you about the significance of adhering to the guidelines. I believe that that is the only sure way we can begin to bring the positive situation that we have in our country.
Let's do some other stories now. The Greater Accra Regional Public Relations Office of the Ghana Police Service, DSP Efiatinje, has stated that the Ghana Police Service, in compliance with the enforcement of the compulsory wearing of face masks, will not use violent means to enforce the President's directive. Speaking to Adoatv news reporter Albert Ego, she said the police service mainly use calm and advisory means to ensure that all citizens obey the President's directive.
We know that there are a number of health and safety protocols that have been outlined even at the international level to speak about the WHO, and these health directives of measures are being advised to be able to contain the spread of the coronavirus. And one of them that we all know is the wearing of mask. We know what it can do in curtailing the spread of this virus. And so we also have our Excellency, the President, also advocating and asking that each one of us put on the mask. Quite apart from that, we even had various regional security, as the research councils, also coming out with the compulsory wearing of the mask. We've also heard it from the National Health Service and Weatherview. What we expect by now is for all of us to realize the essence and the relevance in wearing the mask, because it protects each one of us. It protects you from contracting, it protects me from also contracting, or it reduces my exposure to the risk of contracting the disease. So far from that, we are doing more of advocacy and advising that people do so. It is the best of way for now to go than to think about arresting people and putting them before courts and what have you. We continue to use this measure a way of advice, by way of sensitization, education, and this approach would make people realize the essence of using the mask. And also, what we also think we should all be doing as good partners in the fight against this virus is for institutions, entities, corporate bodies, every one of us, individuals, to ensure that people who enter their yards, people who enter their forecourts, their premises, their facilities are well masked, so they don't come there to either contract or come and also infect others. So we know that a lot of people are doing this. No mask, no entry is something that we should all endorse, because we don't know the person's, how do we say, how exposed the person has been. So from what we all know, by now, everybody should be able to prevent people who do not have the mask from entering their facilities. Because looking at the way we are going about this, much success will be achieved if all of us are able to abide by all the necessary protocols, especially the wearing of the mask. And all that we are doing is advocacy. It's for people to understand the essence of wearing the mask. Apart from that, there's little that the police can do in this regard. So those that we have been enforcing, we see them in EIs, and that's executive instruments like the social distancing, the ban on public gathering, and so forth. And all of these ones, and most of them, people who have been arrested since the partial lockdown until now, as we speak, people are still in court, battling their cases. Yes, so with this one, it's more of advocacy.
The Ghana Police Service, the Mothers Union of the Anglican Diocese of Accra, has paid a visit to the Ghana East Municipal Hospital to contribute their quota towards the fight against the novel coronavirus pandemic. They have donated some items such as paper napkins, liquid soap, packs of drinking water and food to frontline health workers of the hospital. They believe will motivate them as they fight the deadly virus.
Coronavirus, also known as SARS-CoV-2, a deadly virus that sprang up in Wuhan in China at the latter part of December, has displaced a lot of countries' economies. The virus that has claimed a lot of lives has seen health workers worldwide on their toes in finding a potent vaccine for it. Ghana, as part of the affected countries, has put in diverse measures to help bridle the spread of the virus as our case count rises to over 5,000. Some preventive protocols such as wearing face masks, washing hands with soap and running water, using of sanitizer and the likes. The Ghana East Hospital is playing a pivotal role in the fight, have received donations from individuals and groups from different backgrounds. This follows the call by President Akufo-Addo to churches and groups and individuals to support health workers with relief items. It's on this background that the Mothers Union of the Anglican Diocese have donated some items to the health workers of the hospital.
My name is Hilda Kome, and I'm from the Anglican Mothers Union. Our union is kind of an international organization within the Anglican Church, and it's worldwide. We thought it wise to come here because we operate under a concept with the acronym MULWA. MULWA simply means the Mothers Union. We listen, we observe, and we act in step with God. So having heard of what is going on, the pandemic worldwide, And in Ghana, on the radio we hear, TV we watch, we realize that this is an opportunity to come and help, especially the frontline workers. We thought it wise that we need to come and appreciate you, whatever you are doing, being the gallant soldiers in front of war, well armored. We also need to come. On behalf of our Lord Bishop of Accra, Right Reverend Sylvanus Daniel Mensah Torto, and the members of the Mothers Union, Anglican Diocese of Accra, we have our widow's mite to present to the frontline workers of Ga East Municipal. 3,000 bottles of water for you. We have Nutri-Snack biscuits, 15 packets. We have king-size tissue for you, 15 gallons of water. And I hear Eku is something you love so much. So we also brought some Eku drink.
The medical superintendent of the hospital, Dr. Ebenezer Odro-Mensah, who received the items on behalf of the hospital, thanked the union for the kind gesture and appealed to the general public to emulate their gesture.
We appreciate this kind gesture. We are looking at what we as health service providers need to be healthy, okay, to ensure that we can go out there and help take care of the patients who are in our care. Currently, we are doing about 70 patients in our care. And it's a lot of stress. We've been doing this for the past 6 weeks, going 7 weeks. It's a lot of work, a lot of stress with the staff. And we appreciate the fact that today you've thought it best to bring us items, not just to eat and keep healthy, but also to protect us from contracting the infection. The government has been very supportive, but we require such gestures from the private sector, from organizations, to support the efforts of the government. Because this virus can come to your home any day, okay? And it's nobody's fault that this virus is out there and people are contracting it. It's nobody's fault. Unfortunately, people are being stigmatized unnecessarily because they have COVID. Presidents have had COVID in some countries, prime ministers, top shots, ordinary people. It doesn't respect anybody, you know. So we need to fight against the stigma out there. And I think as the Mothers Union, you also have a role to play in educating your members and for them to also educate their wards at home and those they live with on the preventive measures put in place by government to ensure that, yes, we do not contract COVID and we will help to fight the COVID pandemic. So once again, we thank you very much, and we'll make sure that every member of staff benefits from this kind gesture.
If you just join us, here's a recap of our top stories. Novel coronavirus could become endemic. This is coming from the World Health Organization. Now, Ghana's case count is now 5,530. We also told you what the health minister believes lockdowns won't work anymore. That's it for me on the news this morning. We'll bring you an update of these stories in our primetime bulletin. Meanwhile, you can visit our website, www.adwanewsonline.com. From me and the rest of the team, thanks for watching. We'll see you again on Monday, but until then, stay with us on AM Ghana Show as we deliberate on real issues bothering Ghana. Good morning.